Hello, you're watching The Wire. Today is April 1 and this is the daily COVID-19 updates bulletin. Almost 1,466 people in India have been infected with COVID-19 so far. 132 have been cured or discharged and 38 have died. A large number of Indians who attended the Tablighi Jamaat meeting in New Delhi and who are now back in their states like Karnataka, Andhra Pradesh, Jammu and Kashmir, Bihar and Odisha have been quarantined. Of these, 110 have been tested positive in Tamil Nadu alone, 43 in Andhra Pradesh, 24 in New Delhi and 1 in Assam. After Indian health authorities have found themselves in a tough spot over personal protective equipment as cases rise and doctors ask for more protective gear, India has started looking at importing personal protective kits from China, Singapore and Korea in order to meet its requirements. This was according to a report published in the Economic Times today. Last week, a government-owned company and its nodal agency on procurement, HLL Lifecare, rolled out a tender, but the government said that they don't want to wait for bids and instead look for other countries to source PPE. A senior health ministry official told Economic Times that we are looking at whatever source is available. On the 23rd of March, the Caravan magazine had reported that PPE manufacturers in India were opposing the Indian government's decision to centralize procurement through HLL Lifecare Limited. The Union Health Ministry recommended the use of antimalarial drug hydroxychloroquine in combination with azithromycin to those suffering from severe COVID-19 infections who require ICU management. They also recommended it for doctors who are in contact with COVID-19 patients. Hydroxychloroquine or HCQ is not a proven antiviral drug for the disease. However, the ministry said that based on off-label indication, patients with severe disease requiring ICU management can use the drug. On Tuesday, in its daily press briefing, the ICMR also said that they will collect data and decide if the drug is for common people or not. As China begins to ease lockdown restrictions, the Chinese people are worried about asymptomatic positive cases in China. To dispel public fear, the Chinese health officials have said that they will now begin to report asymptomatic cases as well. This was not being done earlier when the outbreak first began in China. No asymptomatic case was being counted in the official data. But as lockdown restrictions are being removed, there is fear among the Chinese that people with the infection who think they are healthy will end up spreading the virus if data on them is not released. The Chinese Health Commission has said that all such asymptomatic people that have been identified, around 1,300 of them, will be centrally quarantined for 14 days. Because of escalating coronavirus situations in the US, a record 3.3 million Americans have filed initial jobless claims for the week ending March 21. Of these, over 20,000 are Indians who hold the H-1B visa and have lost their jobs too. In some cases, companies have already informed their H-1B employees that they are on top of the list of being fired. Those on H-1B visas in the US are neither eligible for unemployment benefits nor entitled to Social Security benefits, even though there are deductions from their salary. Under regulations, H-1B workers have only a 60-day grace period of unemployment time during each authorized validity period to stay in the US legally. They must find new work within 60 days or leave the country. Looking at the situation, Indians holding H-1B visas and who have lost their jobs have requested the United States government to temporarily extend the 60-day grace period to 180 days and protect them. There is a frequently asked question if mosquitoes can transmit the coronavirus. Based on current studies, it is highly unlikely that a mosquito will pick up the virus by biting an infected person. Although coronavirus has been found in blood samples of infected people, there is no evidence that it can spread via mosquitoes. Even if a mosquito did pick up a high enough dose of the virus in a blood meal, there is no evidence that the virus would be able to infect the mosquito itself. But why do some viruses travel through a mosquito and some don't? When a mosquito bites and sucks up blood that contains the virus ends up in the gut of the insect. From there, the virus needs to infect the cell lining of the gut and infect the rest of the body. After infecting the body of the mosquito, the virus has to infect the salivary glands before it passes on to a human. But to do this, the virus also has to negotiate getting out of the gut, getting through the body, and then into the saliva. Each step in the process can be an impenetrable barrier for the virus. This may be straightforward for some viruses, but for others, the virus could either perish or be excreted. That's all for today. Thank you for tuning in. Keep reading thewire.in. For more science, health, and environment news, log on to science.thewire.in.